and I don't know whether she's not feeling well. And Julie Kohler is not going to come. She's not feeling well, and I asked Ian to set up a Zoom for those two. Joan will not be joining us. She had to work tonight. And Bob, I'm expecting, he's a hardworking man, and I'm sure he's got his reasons, but we do have a quorum of 5, so I'm going to call the meeting to order and ask that we stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And this week this month we do have minutes. Actually, we had a quorum last time, and we had the privilege of having Kathy here to take our minutes. I hope everybody has had a chance to review them. Are there any comments, corrections, criticisms, omissions that anybody wants to raise? Then
I have one silly one. My name is Magggy.
I don't think that's silly at all.
So my name's misspelled.
Eventually we'll get that right.
I was also just going to, actually, I'm just noticing it now, but for this week's, that for Board of Commissioners update and school district update, we have MM and JL reversed.
That's on me.
This is for this week's.
Oh, okay, all right.
Okay, yes, that's on me. So may I have a motion to approve the minutes?
Motion to approve.
Second, please. Approved. And from there, we seem to always have organizational issues, and we have a few. I did bring up the point that we do have 3 members whose terms expire on December 31st, one of whom is Julie. And Julie has told me that she wants to stay on, and I think that's all that needs to happen for her to stay. But the other 2 are tried and true and loyal members, Kathy and Joan, who are finishing their second terms and therefore are obligated to rotate off. I bring this up for a couple of reasons. One of the people rotating off is Kathy, and we will need a new vice chair. And the other is that the sooner we can get people aware of and expressing their interest, the shorter the gap will be in our manpower on the committee. And since all the work the committee does is the work that we do, I think that is important. So Alex actually tweaked Maggie on that. We sent it over to Kevin, and we're working on posting on the board vacancies, the 2 vacancies that will occur as of January 1st on the board. I also want to remind people, in January we will elect new officers, although there are no term limits. And if needed to be, I would be willing to stay. I also would like to encourage the development of leadership on the board, and I would like people to consider, are they willing to take on vice chair, and now or in the future consider who will eventually take over the role of chairman. And other than that, I don't have any other organizational issues. Anybody else have something they want to bring up there? Okay. We're good there then. The next item, I think, is the oral care van, and that's Bob's. And since I didn't hear from him, I'm assuming he's planning to come, because he would have, by habit, would have sent me word of what to do. So let's defer on that. And then the next issue is the animal health ordinance and road safety. Joan was kind enough to proactively send me a note with her updates. So she met with Bill Gallagher, who is the animal control officer, and they have put together a plan to directly send the updated animal ordinances to the township solicitor for review and rewording, and that is in pathway, and they are hopeful that we will be able to promptly get an edited version and eventually get that over for final approval, which will be one of the landmark jobs of Joan's term here. And the other thing that she has been working on is the wildlife signage. She worked with Bill Gallagher on that. She emailed him a list of suggested roads, which are generally either running by streams or green areas, or in high-speed zones, and they are going to develop next steps in terms of moving that project forward. And if we are not done by the end of the year, Joan and I will work on figuring out who we might be able to transition that to. These have both been on our old business list for a long time, but it feels like as if we are coming close to finishing both of those. And she says to everybody, have a nice Thanksgiving from Joan. So I'll pass that along as well. And then I am on the list next for what I called at the time, I was probably groggy, it was probably 6 a.m., fall vaccines and COVID. I think we should start calling this respiratory illness update, and I'll show you why. I have the CDC website queued up. They have a site that's actually called, they have an ongoing COVID site, but they also have a site that is called FluView. And I think there's some alarming data that I'd like to share with everybody. I know that everybody can't wait to be alarmed again. And hopefully, here we are. I'm going to go get Ian because hopefully it'll come up on the screen. Here we go. Just have to wait a sec. There we are. So this is the FluView. If you just go to cdc.gov and type FluView in the search or mark the page, you won't have to do that anymore. This is their weekly surveillance report. They've been doing MMWR since I was a medical student and I started medical school. It'll be 50 years in August. So it's a long-standing, immensely valuable resource in tracking the winter respiratory virus season. Now let's see, am I on that? There we go. And I'm going to come back and go over some of this, but I'm going to go right to the punchline. And the punchline is on this chart, which is the percentage of outpatient visits for respiratory illness reported by the survey, ILINet, Influenza-Like Illness Surveillance Network. And it's not an accurate position from numbers. Nobody is saying that they have a numbers count on cases, but it's a highly precise tool with year-on-year membership that gives a very good picture of what is going on with influenza. And if you look, we got going back to the 17-18 season, so we really have the last 5 years, and you can see the year of COVID, we had very little flu-like illness. And for those of you who may still have doubts as to whether mitigation works for reducing the transmission of respiratory viral illnesses, I think that that's a pretty good piece of evidence to suggest that respiratory viruses can be, spread of respiratory virus can be curbed by mitigating efforts. But I put this up because this is the very disturbing piece. Nobody remembers a 40th, 41st, 42nd, 43rd, and 44th week of the year. This is the week of the year. Instead of dates, they go by what week of the year it is, so you don't get carried away with the exact day number, but where you are in the year. And you can see that this is every bit as bad as the worst outbreaks that we've had, except it's occurring 12 weeks, 10 weeks, 12 weeks earlier than the previous outbreaks. So the it here is not flu, nor is it COVID, nor is it RSV, nor is it any of the other respiratory illnesses. It is the percentage of people in the ER who are visiting for respiratory illnesses. And you can see it's up to 6% of all ER visits are respiratory illnesses. And we have a pretty good sense that there are actually two major contributors to that. They are influenza and RSV, because the COVID numbers are pretty flat. There is not any major COVID outbreak going on in the country, and upper respiratory illness is not necessarily the predominant presentation of COVID at this point. I'll put this up just to show you that flu and RSV tend to be diseases of the young, 0 to 4 and 5 to 24. School-age people are highly susceptible to spread of respiratory illnesses. And the older age groups, including the oldest, the one that I fall into, do not tend to get these respiratory illnesses as often. However, this year, in any given year, although the very old do not tend to get as much flu, the mortality rates and morbidity rates in the very old are substantially higher than in any other age group. The very young have an awful lot of flu, and although the rates are not terribly high, morbidity and mortality in the youngest age group is also an issue. This is not a particularly helpful chart. This chart I bring up because this shows you the geographic location, and we're here. And it's nice that we're only in the high moderate group. I'll point out that these blues, that very highest, that was added. That blue was added this year. Until this year, they stopped at the darkest brown, and that's because there are areas with a huge amount of activity. But you can see there's very high activity in New Jersey, very high activity in Maryland. And so thus far, and I think this goes through the 12th, thus far we have not seen a huge outbreak here, but we're surrounded by it, and we're in a position where we're fortunate enough to be able to take steps. Let me spend a minute on RSV. RSV is normally considered to be a not terribly fatal disease that's predominant in children. And adults who get it generally are presumed to have milder illness. RSV this year started early. It is ferocious. There are places where the healthcare system is overwhelmed with upper respiratory illnesses, RSV and flu. Kids are getting sicker, but the other thing is that adults with RSV are getting sicker than historically people have presumed that RSV would cause them to be. It is a very early RSV outbreak. My own hypothesis, that people are calling what's going around in Radnor the Radnor crud, my belief is it's probably RSV, but we're not necessarily testing for that. It requires special virological tests. And my hypothesis for why we may not be seeing that here is I actually think the RSV outbreak, I think we had ours. I think we had it in September and October, and that may be why we're not seeing the kind of peaking that we're seeing now. That's purely speculative and hypothetical on my part. What I really want to do is spend a moment on influenza because of the politicization of mitigating factors in the COVID outbreak. I want to come back and talk a little about influenza. Everybody knows that these are respiratory spread illnesses, that influenza is spread by respiratory droplets, And there is some good news. The good news is that the respiratory droplets of size in flu hasn't changed like it did with COVID. It remains fairly large respiratory droplets, and mask wearing is very effective, both for the individual wearing the mask and for the protection that's gained when the individual who is spreading is wearing the mask. So it's not like after the Delta wave with COVID, where the droplets were so small, they were aerosol, you needed to go to an N95 mask. Most of the protection came by covering the face of the individual who was spreading, and protection for the one individual in a room who wears a mask was not getting a huge amount of protection. With flu, if you wear a mask, you can expect to get a substantial amount of protection from wearing a mask. The other advantage of wearing the mask is kind of the bad news on influenza. We should remember that as opposed to COVID, which did not have substantial spread by fomite. Fomite, let's just review, is when a respiratory droplet lands on a surface, it becomes a fomite, and flu does spread by fomite. So touching doorknobs, desks, surfaces, getting the viral particle on your hand, and then spreading it to your respiratory tract through your eye, through your nose, or through your mouth is a common way to spread flu. The good news is you wash your hands, you decrease the spread. And it's another example of where mask wearing can be very helpful in preventing the spread of influenza, because it keeps your hands off your face. Best protection from severe disease remains vaccination. Let me just see if there's any more charts I want to show. There are people who are starting to be hospitalized from long-term care facilities. There are people who are being hospitalized. Here's again the last 5 years. Here's this year. Hospitalization is very early. And you can see that the rates of hospitalization are highest in adults greater than or equal to 65 and in children 0 to 4. There are already fatalities. There are fatalities in some young folks. I'll put this up for a moment, and just if you still don't want to believe that COVID was killing people, this chart ought to convince you of that. These are influenza deaths, 2020. It went away in 2021. It has just started in 2022. There is some pediatric mortality from influenza. And then let me just cover off on one other thing, which is that the overwhelming majority of flu that we're seeing right now is coming from, it's all coming from A influenza. The H1N1 and H3N2 are the predominant sources of the infection that we're seeing now. And the good news is, of the 4 serotypes that, and this is the Zoom, there's still nobody on. The 4 serotypes that are included in this year's vaccine includes H1N1 and H3N2. So your best protection from severe disease is inoculation. The inoculum this year should be effective, and I would encourage people, if you haven't already done it, to get your flu shots. Let me also add the disclaimer: I'm not an infectious disease doctor, a pulmonologist, an ER doctor, a virologist, or an epidemiologist, but I'm an amateur seasonal respiratory illness junkie, as it were. So, with that, I'll close that out. If there's any questions, comments, concerns, anybody wants to raise?
I have one. I was going to bring it up later, but there is a great push to get rid of these dividers that were put up at the beginning of COVID from the school board. And Maura very much would like the Board of Health to weigh in on whether they're doing anything, whether we think they're a good idea in light of what you just said. Just bringing it up. I was going to bring it up under new business, but I figured as long as we're in respiratory virus, may as well bring it up now.
My personal, I don't have any data,
Right.
but based on what we do know historically about the spread of flu, and the fact that we actually have 3 major respiratory viruses that are out there that are exceedingly active, I would think that if you wanted to take them down, you might wait till May. I don't see what the advantage of taking them down might be, but I can tell you I see a clear-cut advantage for keeping them up until we see when and if this wave of the tridemic or whatever, see what happens, see if it materializes. I actually think from a COVID point of view, if you were in a room for more than an hour, these are probably not giving you a huge amount of protection, except if the guy next to you is shouting angrily and spitting on you, then you might get some protection. But that protection is dramatically higher, both for RSV and flu. So I don't know, is anybody who has a contrary opinion among those present or possibly on the phone who I heartily endorse not acting precipitously at a time when they may be providing protection for the people that are trying to do the right thing for the community. So I think you could take back to the Board of Commissioners that it would be premature to take them down until we see our way out of the flu season.
I think part of the request was coming from a standpoint of visibility because of the fact that the monitors that had been on the desks are in the middle of getting replaced. And I think that was part of where the request came from.
I think it's visibility and
Right.
communication.
Yeah. I guess my only comment would, I mean, certainly from a mitigation standpoint, I think having them up is better than not having them up, relative to the fact that there isn't a mask requirement for this building at this point. I guess I just, in terms of orders of magnitude of effectiveness, I don't know what we're talking about, but I don't disagree with the idea that the smarter thing to do would be to wait until we're out of, the current season.
So I'm not sure that and Seth, did you want to speak? Please go ahead.
Thank you. Yeah, I mean, I think that if this was a routine respiratory virus year, then the discussion would be different. The COVID virus is not circulating in quite the same way that it was in the prior years in terms of hospitalizations and death rates, but like the statistics that we just reviewed, other respiratory conditions are highly prevalent compared to other years. This is not a usual year by any means, and so I think that it's the better part of valor to leave them up, just like was previously recommended. It's the social distancing that has always, even before COVID, protected us against respiratory viruses, and like was discussed, that's even more true for the other conditions than potentially for COVID.
Thanks, Seth. You summarized it perfectly. I'm struggling to understand what huge value in terms of visibility of what and socialization for whom will be. And I don't, in this room, I can see everybody. Maybe I have to move a little bit, but I can see everybody. And I can accommodate to be able to see whatever screen I might have. It might be a little trickier.
I was referring to the projectors on either side.
Okay,
They're
yeah,
slightly
so-
obstructed.
Yeah, my bottom line would be that from the Board of Health point of view, there's value in having them. I don't know what the immense value in taking them down is. We're about to see whether we have a really nasty respiratory illness season, and I would strongly recommend that you will more likely benefit from keeping them than taking them down.
Thank you.
By the way, I also I got in touch with Hallie Ammons, who is one of the assistants to the president of Villanova University. She had sent a letter to Kevin, actually, at the beginning of the year, not everybody was here then, updating us on Villanova University and their mold remediation program at the beginning of the year, this year being proactive. It was a really nicely laid out letter. But I had asked her if they were tracking flu and respiratory illnesses at Villanova, and if they had seen anything, and she said they do track, but they don't release the data, but they have not yet seen, they are prepared for an uptick, and they have not yet seen one, which to me is a great relief, because that's the kind of place you're going to see it if it's here. That's certainly the kind of place you're going to see it. So, anything else on that topic? All right then. So now we're to student interns, and I'll turn it over to Alex to run that conversation.
Yeah. So Lisa wasn't able to be here tonight, but I did meet with our student intern.
May I interrupt for just a second?
Oh.
That is one other behavior that I think that I would strongly encourage. Lisa's not here because she's got the crud. Thank you, Lisa. Julie's not here because she's got COVID for the second or third time. I don't remember what you said. Thank you, Lisa. And we're all going to be headed this week to family meetings, and a lot of people are going to travel. If you have the slightest symptom and there's any doubt, don't give it to other people. Just don't even take the chance. That's another thing that you can easily do. There will not be any mandates, but there are common sense behaviors that people can undertake to diminish the impact of what looks to be a pretty vicious respiratory illness. I'm sorry to interrupt, Alex. I'll really turn it over to you.
We discussed what, kind of where the progress is, and then also what timeline needs to look like going forward. The students at this point are pursuing the direction of between the two topics that had been or two potential topics that had been discussed last time, going more in the direction of the driving and attentiveness related to sleep. I think one of the things that they discussed was potentially looking at, since the other topic that had been discussed as a potential topic for them to look at was differences in healthcare outcomes based on socioeconomic status. I think they may try and look at whether that factors into what are there differences between, for example, students who are working a second job, working a job in addition to going to school. So that is the direction that they've chosen for their project, and they are going to be working together, which I know we hadn't totally established as of the last meeting, but that is where they're going now in terms of the timeline going forward from here. I think as of the next meeting, we said that we want to see a definite plan of execution and a definite timeline for the kind of steps we want to hit along the way, emphasizing again those SMART goal principles. And then the other thing we discussed is taking a very strong look at trying to have things ready by the May meeting rather than the June meeting, for a couple of reasons, one of which is that the way the calendar worked out this year, senior finals are ahead of that, and that's going to end up being senior week. And then also just the fact that what we ran into last year, that if for any reason things don't end up quite being ready by May, if you shoot for May and then you miss, then you end up being much more well set up for June. But also just in terms of making sure that the project isn't bumping up against their final schedule, and really having things ready to go there. I think that there was some agreement from the students on that might be a good goal to work towards, is trying to see about having things ready for the May meeting rather than the June meeting. And that is where things are.
Excellent, thanks. In terms of the value of this, this project to the interns, I think that the things that you raise are exactly the kind of things that you'll see when you are through your schooling and into your career life, that competing priorities, external obstacles, dates and timelines make fulfilling commitments that much more difficult. Right now, anybody who's managed people will tell you, from now until the first Monday after New Year's, it's really hard to get stuff done. And the only way you do it is by being organized and committing and putting aside the time that you need to accomplish your commitments, because there will be lots and lots of distractions. So I think that you guys are off to a great start, and hopefully this will be a valuable experience for you to carry through your educational and then eventually your career lives. So thank you for that. Now, Alex, you did also want to spend a little bit of time talking about the getting a head start on the process of selecting interns, or do you want to take that on now? Or?
I did, and I am having trouble getting it to load now. Why don't we see if I can get it to load, and if I can, I will raise it under new business, and if not, then, oh, no, here we go. Okay. All right, so, yeah, so I wanted to take a look at possibly standardizing the both the criteria and also the selection process for the student interns for next year. We've been getting more applications every year, in particular just looking ahead to next year and knowing that we got a number of very strong applicants from the junior class for next year, taking a look at our process for doing this. So what I discussed with David is that I would present what I am proposing as kind of making standard practice going into next year, so that we're not kind of scrambling next year to say, okay, how are we going to do this? That I would kind of go over that tonight to present it in public, and then I would send that out to the board so everyone can kind of see it written down, and also then have some time to discuss for the next meeting. If there are people that think certain things are a good idea or aren't a good idea, then maybe we can discuss that and even vote on it if necessary, so that then when we get to next year, we're kind of all set to go, and we're not kind of going, okay, now wait, how did we do this last year? And, also just making sure that there's some consistency year to year, because this is a public process and the members of the board do change. So so I guess one question would be, we have had the number be 2, but does it actually need to be capped at 2 is one question to consider. I'm not saying that we necessarily make it into a thing where every single student who applies can do it, but that number we have been having it capped at 2. Is there a particular reason for that? Could we make it 3 if we're getting that many qualified applicants? We're, I think, somewhat limited by the number of microphones at the podiums here. I'm not saying we need to fill up every single one, but is there a real reason that we need to cap it at 2 if we have more qualified applicants than that? So that's one potential question. Another potential question, and David, you kind of raised this at our last meeting, is that it was kind of presented in the initial letter that it could be an individual or group project. I kind of agree with your notion that I think we should just standardize it as it's a group project. But that's something we could discuss as well. In terms of the actual letter, I think, specifying when the meetings are, again, I think we should maybe specify that it's a group project. In terms of what we're asking the students for, I think this year it was kind of, they sent us what they sent us to an extent. I think we should specify that they need to include a resume, and then also specify if we're asking them for what essentially is a cover letter, give a little bit of guidance on what should be included in that letter, since for many of these students, this is going to be their first time writing something like that. And then some other things for us to consider. We haven't asked them to pitch a project with their application, but maybe that's something that we should ask them to do, because if we get students who are coming in with project ideas that we like, that might be a benefit versus just asking them to explain what their qualifications are and why they want to join the board. Asking them to include a pitch for a project is something I think we should consider. We haven't asked for a transcript in past years. I think based on the number of applications that we're getting, I think it would be fair to start asking for that. I don't know if we want to set some kind of a GPA limit, but based on, getting 10 applications this year, I think it's fair to at least make sure that we're setting some kind of threshold where we're at least filtering for, the kids who are turning in their homework fairly regularly, taking some of those AP science classes, maybe, things like that. And then in terms of the criteria that we're looking at, we have this kind of general notion that we're looking at extracurricular participation and, with a preference for things that are in the health and public health sphere. But again, standardizing that, having it written down so that, students who are applying to this have an idea of what the criteria are that we're using. Again, taking a look at maybe certain classes, and do we want to, weight things in favor of students who are taking, for example, AP Bio, AP Psych, the bioethics class, the medical careers class, maybe AP Chem. That's something we could consider. And then lastly, the fact that it is open to juniors, seniors, and sophomores. I have kind of pushed for in the past that we weight things somewhat in favor of seniors because they don't have the opportunity to apply again next year if they don't get selected this year. But I think, again, that's one of those things that rather than being sort of the preference of whoever's looking at it in an individual year, we should, again, just maybe have it written down and somewhat standardized. And so again, I'll be sending all of those suggestions out to the board for everyone to kind of take a look at and give their feedback on at the next meeting, so that we're not making a decision tonight with, limited time to look at things. But those were some of the ideas I had for how we can kind of standardize things going forward. And we can discuss some more at the next, if we want to discuss tonight, we can, but I had intended it to be introduce it so that everyone can look at it and plan and discuss at the next meeting.
Thanks. First, let me again thank you and Lisa for all the work that you put in. There's another learning opportunity for our students here, and that is that it doesn't matter to me whether you're in academia or in private sector. The work of the committee is not done in the committee meeting. The work of the committee is done between the committee meetings, and it is digested and finalized at the committee. And so this is work that Alex is doing between the meetings. That's number one. Number two, I think you laid an awful lot out there, and I think that your plan of organizing, codifying that, circulating that to the board to initiate there are several topics that you raised. One is how do we introduce this to the students? Two is what do we ask of the students? Three is how do we select the students? And four is how do we generate the program? I think there's an awful lot there that you have already raised, and that we can codify and organize that better, and not necessarily put tight straits on it, but just have it more uniform, more codified, more organized, and it will be better for our students if they understand what we're looking for when we send out that letter asking them to apply for a Board of Health internship. They'll have a better idea of what it is and what it is they need to bring to the table in their letter. So I think it's a great idea, and I think your notion of getting it rolling, working it between the meetings. The one thing, I don't believe there's any possibility that we'll settle all those questions out next month. And we don't have to. I think that if we get this finalized by the time the students finalize their project, so that when we take a break at the end of the June meeting, we can know that we can launch. I think that it's something we did this year, sending the letters out before we actually met in September, so that we can launch quickly, that will be better organized. I think that's all great ideas. So thanks again for the work you're doing.
Yeah, sure. And I agree that we don't have to agree on everything by the next meeting. And it could even be something that, we improve on what the criteria we are using year to year. But I think, based on the fact that this year we had 10 students applying for 2 slots, I think it's time to start making the process a little bit more formalized. So.
Great, thank you. Anybody else have a comment, question?
Yeah, could I quickly, I would just think you might want to ask these two as they go through this, if they have any input as far as questions, criteria, that sort of thing. You guys know it from the inside out, and you're already in, so you can say what you'd like, and that could be very valuable.
Yeah, and in fact, I did actually ask Ray and Khadijah about a couple of the things that I just raised. But certainly throughout the process, I think, and revisiting that at the end of the process. Yeah, I will. The other thing I'll just very quickly, I do want to say, and we do have our school board liaison here tonight, just how impressed I think we all were at the quality of the students who were applying, and of course the 2 that we selected as well. And I mean, even the fact that they all had the opportunity, the juniors who were not selected all had the opportunity to get feedback on their application for how to improve it for next year, and all 5 of the juniors responded and did that, and we had those meetings, and they're all great kids, and so great job to all of you over on the school side of things.
Thank you. So with that, may I move on to the new business section and turn it over to Maggie, if there are any updates from the Board of Commissioners?
Oh, there are always updates from the Board of Commissioners. We're thick into budget season, and we're thick into redistricting. So those are sort of overwhelmingly taking up the majority of time at a lot of the meetings. But there are a few things that I think are worth mentioning. One is that the Audubon Council kind of renewed the Radnor being a Birdtown, Pennsylvania, and is encouraging fairly what we would think of as typical environmental actions, such as planting more native plants, less grass, less fertilizer. We should watch stormwater drainage with all that fertilizer in it, that sort of thing. So that's a good thing, and you'll see some new signs that are going to go up around town that say, Birdtown, USA, or Pennsylvania, sorry. The other thing I've mentioned before is starting March 15th, the plastic bag ordinance will be in full effect. It's in a grace period right now. And you will start to see, I saw it in the farmer's market this weekend, you'll start to see signs up in stores. I have yet to see one in Giant, but I keep looking. And I casually ask all the frontline employees when I go into a store what they know about it. And it's getting so that more than half now know about it, whereas when this went into effect, or the grace period started, basically none of the frontline people knew about it. So it's just my own little casual survey as to how things are going. The other thing sort of environmentally is you'll see that the EAC is talking about an electronic survey going around that will survey the public about their environmental thoughts and, preferences, and do they compost, do they, recycle, what things are important to them, which high up on my list during this season is always restricting gasoline-powered leaf blowers, but that's just me. And the other thing I just saw today, so I don't know too much about it, is there is going to be a canvass, which I guess happens fairly regularly by the Clean Water Action of Pennsylvania, where they go door to door and ask people about, water, what do they think, how are things going, that sort of stuff, and answer questions for people on the environmental importance of clean water. So it's pretty much all in the environmental bag today, except for budget and redistricting, which I think you want to stay out of if you can.
So I have a question, as long as we're on Board of Commissioners. So at not the last Board of Commissioners meeting, but the one before that, I raised the issue at Valley Forge Military Academy, the same issue that I raised at our last Board of Health meeting. Any updates on anything with that?
I know that the County Department of Health was alerted as to concerns about mold, vermin, those sort of concrete things. The chief of police noted that there have not been recent calls to the Radnor police about Valley Forge Military Academy, and that's about all I can tell you as far as an update.
So I had a couple things in the first, just as a total alarm in my head. One of the most disappointing moments I've had since I've been on the Board of Health was the reception that I got, and this is 5 years ago, when I went to the Planning Commission with a proposal about the possibility of regulating lawn care machinery. And this gas leaf blower is not only an issue from my perspective, from the point of view of carbon dioxide and carbon monoxide and smelliness, but there's also a sound pollution issue. And it sounds like EAC is, the role of the Board of Health in environmental issues is questionable when you have an EAC, but I think that sound pollution is actually a health issue. So I'm more than happy if we want to start bringing that back and try and take another stab at that. I think that lawn care is important to everybody in the township, but that we ought to be able to have it in a way that comports with what we want in our environment in the township. And I think the other big health issue there are some of these huge rigs that drive down Radnor-Chester Road and barely leave you room for your car to get by on a daily basis, and the constant whine of leaf blowers and other devices. And we do also spend an awful lot of time, you raise the birds, an awful lot of time on animals, and I think that animals are part of our healthscape. And I would just share that in a 3-hour period, two days ago in the afternoon, we had a 4-foot heron land by our pond on our property. And I'm 200 yards off of Conestoga Road. So I'm not out in a rural part of the township. We half an hour later had an 8-point buck come by and eat all the berries off of my winterberry. An hour after that, we had a raccoon come by and try and get into the bird feeder. And then shortly after that, we had a crepuscular visit from a red fox. And there are dozens of species of birds that we see. So it makes for a better place to live, and that's why we spend so much time on it in the Board of Health. With that, I'm going to ask Jenny for an update from the school district.
Good evening. So one of the things that you had asked for is just a brief update of where we are regarding the health of our students. And I did send out an email to our nurses in each one of the buildings. So we have the 5 buildings. And I will say that they came back very similar. It seems that the RSV, or respiratory illness, is really what they were suggesting, with fever, seems to be something that would be at the highest level in all of our buildings. There's also a little bit of what they like to call a stomach bug, which is always easy to spot, especially in elementary. So we've had a little bit of that. It does appear that our COVID cases have gone down. We do not continue with the collecting of data and putting it up on our website, as many school districts, if not all that I'm aware of, around us do not, and CDC, is not going in that direction and making that recommendation. But I will say, none of our buildings have had the need to close any classes or have had significant even staffing issues due to illnesses at this point. So that's the good news. We seem to be holding pretty steady, and we are going to give ourselves a little bit of a reprieve, but as we know, all of our families are going out and being with a lot of other family members, so when they come back, sometimes we see that grow a little bit as we enter into the beginning of this next month. So that's kind of where we are with our students' health. And I just also wanted to report out on something that we did in my office. Again, I'm the Director of Student Services, so I'm basically in charge of special education teachers, the psychologists in our building, the social workers. And I just wanted to let everyone know that our social workers put on something what we call the partners meeting, and it's really the community partners. We did it during the, it was the 8th, November 8th. We had a half day where we asked community members to come in and work with our teachers so that we can actually see each other. It's the first time it's been live since 2019, so that was very nice. Or excuse me, it was 2018. But we really were excited as we had a lot of Radnor mental health professionals come in. We also had the police department. We had different schools that work with our teachers and work with our students that provide services for them. It was a really great program so everyone could come together, meet each other, and put faces to names and just talk about the different things that we do for our students in Radnor. So that was our partners meeting, and hopefully we're back on schedule to have them live every year as we have done in the past. And I believe we started that practice in 2013. So we want to continue that because it really does help everyone to come together, and we call it like a breakfast. We have a nice little breakfast for everybody, and it's a really great thing. So that's kind of what we've done in Radnor here in this last month.
Thank you.
So very quickly, I just wanted to advertise, I know David brought it up at the beginning of the meeting, but with the 2 vacancies that we're going to have at the end of the year, obviously they would need to be a Radnor Township resident, and I hate to ask anybody at the schools to, to do more work, but if there is a health teacher, or we already have one of our wonderful school nurses on our board, but, anybody that, is already involved with the school district who, I know it's hard to think that any of them might have a little bit more time on their hands, but if they, wanted to join our board and, would be an asset, we certainly would love to have them if there's any way to advertise that among school district staff who might be Radnor residents. I know we actually did have Marianne McCarthy was on the board, and she was a health teacher at one point. So, certainly it's something that, we would value if they were able to do it.
So we do have it's called the Radnor Reader, and it's something that goes out to all of our parents, but it also goes out to our staff as well. I believe it goes out weekly. It's every Sunday evening. It comes out to everyone, and if you would write a blurb that you'd like in there, I would be more than happy to pass that on. I'm right down the hall from me. Her name's Tedgie. She's in charge of it. I would just take it to her and see if it was something that would be approved to be put into the Radnor Reader. And it goes out to, like I said, all the families and the staff in Radnor.
Sounds perfect to me.
Yeah, that'd be good. Just because I know that
Exactly
our
what
community,
we'd like, right?
yeah, our community's so connected through the school. We found, Julie came to us through a recommendation from a school board member. So that'd be great.
Okay, certainly can do that.
And our last agenda item is our public participation, and Sarah
Sorry,
has asked
so
for.
one thing, I was going to also
I'm
raise
sorry.
it under new business very quickly from the inspection reports. I missed it when it happened in July, but I did want to give a shout out to the cafe at AFC Fitness, which since the Delaware County Health Department has taken over, has become the first entity in Radnor to get a perfect inspection.
Excellent, because that's where I'm going. Is AFC. Glad to hear it.
Good evening. Sarah Pilling, 29 Garrett Avenue. I was on the EAC and the Green Team, and although I've resigned from both of them, I'm still totally committed to climate change. So in that light of that, last Friday, I attended via Zoom the Center of Excellence in Environmental Toxicology, which was held at the University of Pennsylvania. I attended by Zoom. Unfortunately, there were some technical issues to it, and I only heard bits and pieces of it, but I wanted to tell you because I think so much of it is public health. The concerns globally that were to be expressed by this conference was water quality, food insecurity, air quality and the consequences to the respiratory system, the effect of heat stress on cardiopulmonary concerns, insects and new diseases coming from not necessarily new insects, but insects that have moved north. And I think immediately of dengue fever, and actually I experienced dengue fever twice. And the second time I wasn't sure I was going to live, and I was afraid that I didn't want to live. It's not a good disease. And PTSD and mental health concerns as a consequence of climate change. Well, the keynote speaker was Michael Mann, who I think everybody knows or should know, and who's moved from Penn State University to the University of Pennsylvania. And he had some severe concerns and also some action items that need to happen. So Mann said that we must reduce CO2 levels by 2030. That's 8 years, 7 years in a month, in order to avoid catastrophe worldwide. Now, in real time, and he was wonderful in using slides of Philadelphia and the environs in his concerns. We have observed increased rainfall, sea level rise, melting ice, intense heat, and increased deaths from heat. So he's claimed that 1 in 40,000 people have had death by heat and by climate change. That was in 2021. We have increased drought. I'm sure you've seen that the Mississippi is becoming very nearly non-manageable or navigable due to drought and the shrinking of the river, and it carries extraordinary amount of our foodstuffs from the Midwest to important areas. Forest fires, which is there is no longer a season for forest fires. Floods, temperature, and humidity, as indicated by the dew point. He's very concerned about climate justice for residential areas that are more flood prone, that have little heat abatement. So I know that PHS is doing a very sizable program on planting street trees, particularly in these areas of Philadelphia, most notably North Philadelphia, that has no trees. But there are areas in Radnor Township where there are no street trees. And he said the flooding with sea level rise and floods in Pakistan, 1/3 of the people now live in areas that is underwater. So the consequence of that is going to be great migration. So he said that very shortly we will need to, and I don't believe Radnor is immune to some of these issues, To adapt to heat through altering the hours of outdoor work from 4 a.m. to 7 a.m. or maybe 8 a.m. for people who work outdoors. Availability of good water quality. Adjust the hours of play, not only for people who live here, but for organized activity by the township. And in light of one example of not only adjusting the hours of play, but making it more possible, in Arizona, they have embedded phosphorescence into their trails so that their trails are lightly lit at night so they can be used rather than during the main part of the day when it's just going to be too hot. To adapt and adopt clothing that allows good respiration, especially hats. This was very evident to increase the supply of power for refrigeration, because with increased heat, food's going to go bad more quickly, and to be prepared for more power outages. So immediately, thoughts for this winter in Radnor, for those who are vulnerable, and I speak personally because I fall into that category of our seniors. With the increased price of utilities, PECO is raising their base rates 16% as of the 1st of December. Cost of food, taxes are going up in Radnor quite significantly. Those on fixed incomes, they don't have the opportunity to pull it out of savings. It's not I'll get more. It's I will give up something. So I have great concern if we have a bad winter, and we have no way of knowing that just as we had cooling centers in the summer, perhaps we need to just make plans for warming centers this winter. So that's about all that on that. I wanted Maggie especially to know that the EAC has entertained the idea of addressing gas-powered blowers. I'm not a member of the committee anymore, but somehow it has been discouraged as not possible to do. For those people who want it, and I speak up, it's something that we need to address systematically, with good intentions, carefully. It is not alone. DC has banned gas blowers. They started with the commercial entities, and then they went over to the residents. But I agree with you, David, because it's not only noise, but it's also particulate matter that is just raised up, and you can't do without it. And another issue I would like to see addressed is the collection of leaves the way the township does it, because they're all blown into the street, and then the street becomes either one lane or a lane and a half, which becomes physical danger, and they lie there, and it's not a good situation. Thank you.
Thank you, Sarah. And with that, our agenda is complete. Do I have a motion to adjourn? Or do I have any more comments before we adjourn? Do I have a motion to adjourn?
Motion to adjourn?
I'll second that.
Meeting is adjourned.